D deficiency in college athletes' performance. My name is Marissa Lewis.
And I am Cassidy Jones. For introduction, the problem is there is a worldwide deficiency in vitamin D, especially within college athletes. The body needs a sufficient amount of vitamin D in order to support other functions in the body, which will be discussed a little bit later. Vitamin D does not add alone. Magnesium also plays a role in helping maintain normal muscle function, which leads to vitamin D being synthesized. The toxicity rate for vitamin D is 250 micrograms or equivalent to 50,000 units per day. The symptoms of vitamin D deficiency include anorexia, frequent urination, excessive thirst, nausea, vomiting, and in critical cases, mental health status is impaired and kidney failure. Dosing factors. These are the factors that should be considered when trying to determine the appropriate amount of dose. Intensity of sport, the duration of the exercise time, age, gender, ethnicity, and how deficient the athlete is. The gap to focus on. Our research gap is in previous studies, deficiency in vitamin D has been a topic, but did not go in depth about muscle recovery nor athletic performance in college athletes. We would like to explore the gap to focus on natural sunlight exposure aspect of receiving vitamin D. The cons are that dehydration, which can impair an athlete's ability to perform at their best. But there are positives to having more vitamin D, which include less risk of injury due to stronger bones and muscles and improved cardiovascular health. While exercising, protein synthesis plays a role in muscle protein breakdown and muscle protein gain, which enhances an athlete's performance. This leads to the question of why not go outside more? Why supplement a vitamin that if consumed too much, it is toxic to an athlete's body and therefore setting them back even farther than where they started? This research was done from the sources from PubMed that are medical and scientific journals. Research questions and objectives. How does the vitamin D play a role in muscle recovery and performance? Comparing the difference between athletes who mainly train indoor versus athletes who train outdoor. How the body reacts to being vitamin D deficient for an athlete. How does vitamin D support muscle recovery in athletes? What are ways to improve vitamin D levels in athletes that are deficient without supplementing too much?
For our literature review, we analyzed multiple different scholarly articles. The function of vitamin D is bone health, immune health, reducing inflammation in the body, protein synthesis, musculoskeletal regulation, and muscle growth. Many studies suggest that muscle growth and muscle endurance is crucial for an athlete's improvement in maintaining their high level of performance every single day and week. This is why when an athlete is deficient in vitamin D, their muscle and bone health can decrease. There are two different types of vitamin D, D2 and D3. D2 is received in small amounts through our dietary intake, such as salmon, sardines, egg yolks, red meat, liver, and also vitamin D can be added back into some foods, such as breakfast cereals, plant-based milk, and fat spreads. Vitamin D3 is the way we receive through sunlight. Both types of vitamin D, D2 and D3, are absorbed into the mucosal cells. While doing our research, we have also seen a lack of knowledge about vitamin D within the sport world. Factors that play a role in how our body consumes vitamin D. Ethnicity. Melanin absorbs the sunlight which initiates vitamin D synthesis, and hence decreasing the vitamin D that is made for a given exposure compared to less pigmented skin. In other words, athletes who have darker skin have a greater chance of being vitamin D deficient. Gender. There has been many studies that show vitamin D levels are significantly reduced in men than compared to women. Another factor is how much time is spent outside, getting the vitamin D3 from the sun. This includes what time of year it is and what season. Another factor is the athlete's age, the duration and intensity of their exercise time, and also, too, how fast an athlete can metabolize nutrients, because every athlete and every human has a different metabolic rate, which can affect how long a nutrient can stay readily available within the body.
For methods, selecting participants. Vitamin D screening for athletes from different sports. The sports that we chose are volleyball, basketball, football, and soccer. The participants were chosen based on whether they're male or female, college athletes between the ages of 18 and 24 with a range of ethnicities. Measuring blood levels to observe and learn how much micronutrient is in the body and how much is being used, which in this case, vitamin D. Athletes are then categorized by moderately deficient, deficient, and severely deficient. We would track levels of vitamin D while supplementing half with the proper dosage and half with the placebo. How we are analyzing this data. Evaluating each lab value compared to performance rates and output. Surveying each athlete within the study to ask how they feel, with questions that pertain to muscle recovery, muscle strength, and their overall performance output. Methods that were used in this research were experimental research, the quasi-experimental research, survey research, and meta-analysis. The survey questions that were asked include, are you 18 years old or older? If so, what is your age? What is your gender? What ethnicity do you fall into? Click all that apply. What sport do you play? How many hours are you outside? Have you ever been injured? If so, what kind of injury? How long were you out of practice? How long ago was it? And now here are just some scale rating and open discussion questions that will be asked. Rate the shortness of breath on a scale of 1 to 10. How many days do you stay sore after a training session? How intense is the soreness? And here's the open discussion question. How are your energy levels?
Each role of vitamin D has a part in an athlete's ability to perform. Vitamin D could play a role in decreasing pro-inflammatory cytokines and decrease injury rate, possibly helping with muscle recovery and enhancing performance. Registered sports dietitians can use this information to help supplement their athletes to help them recover better and perform at a better rate. Athletes can also assess how they are feeling after a workout compared to their vitamin D levels. Limitations. Each athlete has a different schedule outside of their sport. On average, a student athlete spends 60 hours a week training or doing school-related activities. Each athlete has a different amount needed of vitamins and minerals. This goes back to the topic of each athlete's metabolic rate. Possible malabsorption conditions can prevent an athlete from absorbing the proper amount of vitamin D their body needs. Limitations within our study was that not all of our sports we picked were in the season at the same time, which affect how much time is being put into workouts and training. Every sport has a different intensity of performance output. Every athlete is different in their own way, just like every human is different in their own way. Some of these issues are outside of the sport. They may not know as much about nutrition and how they can improve their vitamin D levels on their own at home. The use of supplements and accessing the proper nutrition in season is a privilege for many athletes, and out of season they may not have this access to either a sports dietitian or someone who is knowledgeable about supplementing in minerals. The lack of knowledge with nutrition is what hurts the athlete the most. In future studies, some suggestions for future researchers is defining the line between toxicity with vitamin D and just enough to see a difference within college athletes' performance, also with their recovery time too. More studies have been done on sunlight and the maximum amount an athlete can get while being safe from skin cancer and dehydration, because most of the time when athletes are outside, especially in the hotter seasons, dehydration is a big worry for most athletes when it comes to performing. Lastly, another topic that needs to be researched more is the use of sunscreen while in the sun, and how this can affect the body's absorption of vitamin D. On the next slide are our sources, and our sources continued. Thank you.